So I believe there's 16 questions on the Health Savings Finder. And if you have 8 minutes for for the people who want to take their time answering the questions, 30 seconds per question, 16 questions on this it will enlighten you. It will tell you, what do I need? How do I need to do this? Then you'll be able to set up a call with us. Then you'll be able to see that. And if you fill out the quiz, you'll get the free ebook on health insurance for 2026, the ups and downs, the subsidies, how that works. But Courtney, what did you put into that health savings finder so that we'll include the link here at the bottom and they'll be able to understand how to get there. And then they'll be able to understand whether they need the max peptides or the make wellness. And we'll go from there.
Right. So it basically dumps you into 4 buckets. So the first 3 buckets are mainly like, where is the best place to get your health insurance? So we're going to find out if your ACA plan is the best one for you. We're going to find out if private insurance is going to save you money. And we're also going to confirm if your employer sponsored health insurance plan is actually the best one for you. Some people have that option to opt out of those plans or add to it, or maybe remove family members. We can divvy things up. So it lets you know if you're in the right spot or not. And then it will also show you where we can adjust with peptides. So if you're somebody who's a candidate for peptides, we're going to let you know that, hey, we can save you money by coming off of prescriptions, healing your body properly, and then eliminating the need for, and this is the best part about peptides, like they don't have to be a long-term thing. They can be a short-term, especially the injectable things. They can be short-term spurts of like 6 to 8 weeks, and then we can be completely off of them. So, and what that does is it puts us in a position where we can start this conversation, because if you have not had a conversation with a health insurance broker that works for multiple companies in the private space, you don't know what you're missing, because they have been rolling out products in that space every few months for the past 18 months. All right, so there is a plan that we can put together that fits what you need. Take this health insurance savings finder quiz and we can help you find that. And that also includes the right budget. Okay. So we know the laws in the different states. This is going to get us started in the conversation. And I do, because this is something I specifically look for, because I really want people to understand how important it is to take over their own health. There are plans that exist now where you can go to specific doctors, and I will talk with the doctors. I will talk with their assistants that help with the coding. I will talk to that department, because if we can get certain codes on your doctor's visits, we can get them paid for in private insurance. Okay, if we can get specific codes done for blood work, we can get coverage in private health insurance. We just have to have these conversations, which a lot of preventative blood work, like hormone panels, sometimes your health insurance will not cover that, and you're coming out of, you're going to get blindsided with the bill. It's hundreds of dollars to get these types of that you might think are free, and some of the medicine that's really going to make you better, we're not going to get coverage for that. And those doctors who want to prescribe you things that heal you, they don't have a good route to charge insurance because it's not readily available. Not everybody has this option. So we want to talk to you, anybody in that space, about how we can get those things taken care of for you. But the health savings finders, step 1 to see if this is even an option for you. And like we said, about 8 minutes if you really take your time, simple questions, straightforward answers, and then we can now have a great conversation about you.